It's kind of like peanut butter and jelly, where you need CPR. That's your peanut butter. It's really good, but it'll stick to the roof of your mouth. You get jelly. Jelly's really good. This would be your jelly. You put them together. That's what's going to save your lives. Peanut butter and jelly sandwiches are great. You need them both, and you're going to have a much better chance of survival. Just remember to grab it. If you have one of these where you work, pull it out of the case, play around with it, turn it on. Like I said, you're not going to shock yourself. You can't go up to your friend when they're sleeping, put these patches on and shock them. It doesn't work that way. So you can play around with them a little bit just to get comfortable with them, because each machine's a little bit different. And you want to know how your particular machine works. Some of them have a case. You have to push a button, the lid will pop open on it. Some of them will already have these patches plugged in. Some of the machines, if you have them, will have a pink key with them. And so you've got your connector spot here. You put your pink key in another spot, and that's going to tell the machine that you have a child, and it'll give a less electrical dose than it would to an adult. So each machine's a little different. If you turn them on, it's going to tell you what to do, but it's best to know what yours do or does. Any other questions on it?
Where are these units required? Like if you're out where you might expect to find one?
They are required at a health center,
Okay.
like if you're a workout center. They're not required at apartment complexes. Even apartment complexes that have workout centers, they're not required there. Every school is required to have them. Swimming pools are required to have them. Airplanes have them. Go into Walmart, you have them. They're not really required at daycares either, but daycares are starting to get them. There's a lot of grants out there for daycares to get them.
Are they costly?
Yeah, yeah.
What?
If you find somebody who can get you a deal, you can get them for about $1,000 to $1,200. If you're just trying to do it yourself, they're $3,000.
Yeah, so a chance to get one in the workplace would be
What's that?
not happening.
Like you don't just use them on one.
They are reusable. They are. The patches aren't.
Right.
Some of the patches too are going to come in cases. You crack the case, you've opened the patches. So if you're playing around with one and you see like a gray case, don't open the gray case to look at the patches because you will expire it. Or they may come in a bag. You know, these will be inside of like a little bag. Yeah, sealed bag. Don't open the sealed bag. They do expire. We're getting ready to roll our clocks back on Saturday. We do that every 6 months. Every 6 months, somebody should be checking their pads to make sure they're there and that they're not expired. And you also want to check your battery on your AED about every 6 months, because it would suck to show up to an emergency and turn this thing on and have it say, replace battery. It's no good at that point. So they'll flash. Most of them have a little spot to let you know if the battery is working the way that it's supposed to. But somebody at your work should be checking that about every 6 months to make sure it's still good. When you check your smoke detectors, check your AED and you should be fine. So the last thing I'll say about that, the last part of that, the removing of the hair, the drying, the getting the bras off, that's kind of nice to know. If you can remember that, that's great. The need to know is turn it on, plug it in, don't touch them, and it's going to tell you what to do. If you forget to take somebody's bra off and you singe them a little bit, but you save their life, they're going to be okay with it. And again, with Good Samaritan laws, they can't come after you, even if they're upset about it. I guess I got one more quick thing about the pad placement. If you have a large-breasted male, large-breasted female, you've got a breast here, it's hanging down to the waist area. You'll find that a lot with people who may have the cardiac issues because you're talking about older individuals. What you want to do is come up underneath the breast tissue. Take the back of your hand. This is groping. This is professional. Come up underneath that breast, lift it up, put that pad directly on the chest wall, and then lower that breast tissue back down. Because if you put that patch on top of the breast tissue and it's sitting, say it's sitting up here a little bit, when you give that shock, that electricity has to go through a couple inches of cellulite, then through your chest wall to get to your heart. If you can just cut through the fat, basically, you're going to be able to get to that heart a little bit quicker. So if you have things hanging down, that's one thing that you can do for that. Any questions on the AED? Okay, let's go ahead and take another break. We've got to do first aid. That's going to be the last part that we have to do. But as far as mannequins, if you don't have any more questions, we've got the CPR portion done and the AED. So you want to take a break? We'll come back, we'll do first aid, and then you guys will
Do you
be
want
done.
us to take the plastic out of our...
Insurance is saying we have to have one on every single work site. Since we're Habitat, every single house is considered a different work site, even if there's like 3 of them together.
If you put them in your truck though, then you're bringing it to each work site that you go to.
Well, no, because we'll have 4 houses we're working on.
Oh, okay.
Yeah, and they were saying the trailer, just having it in a trailer, which is like out front all 4 houses,
Mm-hmm.
wasn't. This is like talking with insurance.
Really?
Yeah.
We need to switch insurance for
Yeah, I think it would be better, if you got a trailer in front of 4 houses, I think it's better to have an AED there because you can get to it quicker than waiting for EMS to get to you.
Well, right, of course.
And
But
insurance won't allow that, huh?
insurance.
No, he's saying they
We
require
are
it for every
liable.
house.
That's crazy.
We were liable for having insufficient AED coverage.
Dan, just take it. It's all
Still have one,
good.
like at the restore in the office though, right?
There is one.
Found a case.
And the restore?
Did you catch that? They got one at the store.
Yes.
Oh, I don't know.
I don't know if there's.
That's,
Yeah, he didn't know.
oh, okay, you don't know? That'd be good. I mean, they're great everywhere. It's not just elderly people that are going to wind up with this either. They're at the high school in Lafayette, Jefferson High School, they had a kid who was in a lifeguarding class during school and he sunk to the bottom after having a seizure. They pulled him out of the pool, started doing CPR, used the AED and saved his life. And it's the AED that saved him. The compressions obviously helped, but he was going into that funny shaking rhythm and the AED brought him out of it. Without that AED, that kid would have died. To have one when you need it, it's just, you know, it's amazing. And you know, if they hadn't had one at that pool, that kid would have died, and then all these questions would have arose as to why don't you? That's the same thing with, like I was talking about the apartments a little bit ago, where you can have a workout facility at an apartment complex, but you don't have to have the AED. I think that's setting apartment complexes up to get sued. Because if it's a state law that you have to have them at a workout facility, why doesn't the apartment complex? And if somebody goes into a cardiac emergency there, I see that becoming an issue. So it's good. Police officers are starting to keep them in their trucks a little bit more often. But I guess if you were to keep it in a truck and you kept it in there overnight, you got to be a little more careful with that because cold weather may drain the battery, may cause it to have issues. You want to keep them warm. They can be a little bit temperamental. All right, we are moving on to the first aid. We got one video of first aid to watch. We're going to splint each other. We're going to sling each other. And then that should be it for today, at least for my portion of it.
Got a